healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share our nursing perspective without taking up too much of your time. Today, we're really honored. This is one of our specials that's going to be aired during Breast Cancer Awareness Month, which is every October. You can find what breast cancer is on any platform. Last year, we dedicated the whole month to sharing testimonials, particularly of daughters whose mothers died from breast cancer. Fortunately, my mother's still alive. She came on and we divided her journey up from her diagnosis, treatment, into life after treatment. And I shared my personal experience as her daughter. And in fact, actually, her episode is the fastest to reach 100.
Wow.
This year, I wanted to focus on other parts of care once you get that diagnosis. And so we have one episode just on palliative and hospice with newly minted nurse practitioner Anthony Young of the Black Nurses Association in New York. And today we're joined by special guest Ashley Wynn-Grimes, who comes highly recommended by another one of our guests who you haven't quite met yet, Dr. You call her Ani?
I call her Annie.
Annie Audubon, a fellow DMPs of Color member with me. She recommends her. And so consider yourself to be lucky. We're going to talk about medical marijuana. It can be taboo in some circles, but you might be surprised to know that most nurses really love it, especially when we start talking about side effects, when it comes to opioids and narcotics, and just the beauty of what medical marijuana has done for people, both in and outside of the clinical setting. So we're going to do a nice broad overview on what it is, the latest when it comes to research trends and common misconceptions. Who's a good candidate for it? What diseases we typically will treat it for, and symptoms that it can help manage, any barriers to care that people might come across, and where you can start if you're thinking about trying it out. If you're new here, welcome to the Melanin Initiative. My name is Dr. Kimberly Madison, a doctorally prepared nurse practitioner, and one of your co-hosts, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. It's our hope that by watching on YouTube, LinkedIn, or listening on any of your favorite podcast apps, that you feel empowered to share this information with other people just like you, to follow, like, and subscribe, and leave messages in the comments. It lets the algorithm know that information like this is really valuable, so that when people like you look for topics like this, we show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you should call 911. If you or someone you know might be having a mental health emergency, you should call 988, or you can text 741-741. Welcome, Ashley Wynn-Grimes, to the Melanin Initiative. How are you?
I am well. I feel good.
So we do two things here at the show. We love to promote health literacy. That's the whole motivation behind the show, because we realize that in homes and in schools, we actually don't learn about healthcare. And we tell people that they can't trust everything on the internet. And so it's really important that professionals like us are using these platforms to provide credible resources and let people know that there's resources out here that look just like them. The other thing we love to do, because nurses are the largest segment of the healthcare workforce, however, people still don't know exactly what we do. And sometimes our own colleagues don't know everything they can do. So we love to elevate the voice of nurses, and we love to let everybody know the plethora of options in the industry that are available to them. So if you could tell us your journey, first of all, where you're from, and who you consider family.
Oh, who am I from and who do I consider family? So I'm Ashley. I'm from Maryland. Who do I consider family? Anybody that I attract and I spend any amount of time with, you're considered family. So right now, we family.
Love it.
Because I believe that everything is on purpose. Nothing is by accident. And so if we spend any time, I'm going to share if I share any moment with you, it'll be in love. But a little bit about my journey. So traditional roles in nursing, I started off in med surg. Annie and I actually met in nursing school. So that was about 16 years ago. And so I started off med surg. I got my master's degree in nursing education. I ended up in hospital leadership, working a transition to practice program. And then for like new grads that first year, like I was the person who helped facilitate that whole year for them. Um, and then I ended up in corporate hospital, 414 hospital system here in Maryland. In corporate, and I did performance improvement, project management, and some, corporate things that I would never do again. And so and so that's pretty much where I usually start the conversation about my journey, because I was burnt out, like straight up. Like I spent the first half of my career, a little bit more than that, just trying to climb a ladder, trying to figure out how I can progress in my career, move in the direction that people said was the best way to go. And I wasn't really a huge fan of clinical work, so I didn't feel like a DMP was for me. And I didn't really feel like any type of doctoral, like it just was all of these things that played a part. So to make it into this corporate area where we're kind of infusing healthcare and business together, and I'm bringing my nursing knowledge, was like a dream come true at the time. What I found when I got there was that there's more of a focus on money than it is about the patients and like how we serve the patients and things like that. I was responsible for like multi-million dollar projects. At the same time, during that time while I was working there, $15,000 was stolen out of my bank account for, because of cyber theft, and it was a down payment for my home. And so that's where the conundrum came in, because I'm like, how am I saving y'all this amount of money and y'all scolding me because I didn't hit the mark exactly? So instead of 1.4, it ended up being $1 million of savings, while at the same time, this measly 5-figure number is coming out of my bank account. Like it just didn't really seem to make sense to me. And so I wasn't okay at that point. Went through all the things that you go through when you go through a traumatic experience. I was depressed. I was anxious. I was, worried about my home. All these things. I ended up in therapy, and the conversation quickly went to, you need to get on medicine. You need to go see a doctor. All these things. And I was like, I'm not sick though. Like to me, it just made sense that this was happening. I'm overworked here. They're not treating me well here because, of course, I am one of only and few Black women, Black people, sorry, women and or nurses in the organization at that level. So, obviously some things come along with that. And so I think those all constitute for a reason why somebody might get a little frustrated with life right now. But I just didn't know, I didn't have the tools to address it. I didn't know what to do. The only thing I knew of was therapy, and I took that route, but it just wasn't like, it wasn't hitting the way it needed to hit. And so I started doing research because I wasn't going to a doctor. Y'all wasn't going to convince me. And I discovered yoga. I discovered cannabis, the endocannabinoid system, that kind of thing. And when I specifically around cannabis, I was like, wait, what y'all saying here? This is like, they've been telling me this my brain on drugs since I was a little kid. And now you telling me it's medicine. Right. And so we got this coupled with that, this idea that, I could save this and lose this at the same time. Now I'm in this kind of parallel existence, this dichotomy, so to speak, where I was questioning just about everything around me. Like, why is this way? The whole career has been a sham. Like, how can we do this if I had no idea that cannabis was medicine this entire time, let alone this whole neurological system, neuroreceptor system in our body that nobody ever talked about throughout nursing school or anywhere else. And so for me, it became the thing that I needed to tell the world. And I started off with doing consultations with people on their cannabis consumption, friends, family, that kind of thing. Um, it worked like all the time, and people were getting good results and learning new things and adjusting their intake and getting clean medicine and all those kind of things. And So I decided then to create a training course. This landed around COVID timeframe. And I'll re-say that because I don't know if you want that on your podcast, but like during pandemic timeframe. And and so I had to go online. So originally I was doing it in person at a local, place. It was beautiful. I was having food and everything. But then I just took it online, and that's how things just kind of spiraled into what you see today. So I work with nurses, help support them, offer training for them, offer community for them. I'm now a Reiki master, so I do distance Reiki sessions for my clients. I do holistic life coaching. I consider myself more of a spiritualist, and cannabis is a tool in that tool belt at this point. Which is a shift from where I first started, where it was just cannabis, teaching people about cannabis medicine. But now I include that in everything else that I do in my work. I also leverage that performance improvement and do like business development work with healthcare providers and things like that. And then, help people find methods of consumption that work for them and more.
Okay, that was quite the journey. Do you mind? Do you want to shout out the schools that you went to?
I went to Coppin State University. That was my undergrad, and then I went to Towson University for my master's degree.
Wonderful. And I only mention that because I remember being a fresh in high school, trying to figure out where to go. And when you have no point of reference, all the names look the same. And so
Yeah.
someone's going to hear your story, and you're just going to be a starting point for them. You
Oh,
might be an ending point too, depending on what they find when they go to those websites. And shout out to Coppin State. We recently they've collaborated with DMPs of Color, the first 5 to be in their new DMP program. And so
yeah.
they keep popping up everywhere we go. And it
Nice, nice.
sounded like what got you to go to nursing?
Well, you know what? So as a young, I knew I liked to help people when I was young, and I thought it was kids. I thought I was going to be a teacher or a pediatrician. When I got to the big moment after graduation day and we're applying for colleges, it seemed to make more sense to go for a nursing degree. I had no idea like the big difference between a nurse and a doctor, if I were to be honest with myself. Like I'm like, oh, I'll just go to nursing school, then I'll go and become a pediatrician that way. And it's
Mhm.
like, no, sis, no. Very, very different paths. But I ended up never even ever working with pediatric patients at all because in my pediatric rotation, they had me put an NG tube in that baby. It was a 9-month-old baby, and the baby was crying, and I was crying, and it was a whole thing. I was like, nope, this ain't gonna work for me.
I hear that. And so you started off in the clinical setting, the acute care setting in med surg,
Mhm.
which is a whole topic by itself, right?
Right.
And then you moved into leadership. How did you know that that was the direction to go?
I didn't really actually. So I ended up getting my master's degree in nursing education, and that was because I liked precepting when I was working on the floor. It was an
Okay.
education connection there. I was like, okay, like I want to go into education. Then they were like, you got to be a professor at a college, and I was like, that's not going to work for me. Um, and just personality wise, like I have a long career, I'm still really young, all those kind of things. I said no. And I remember after I graduated, I was still working in the float pools for probably about a year after I graduated until another girl who I went to school with, she came up to me and she was working in the same hospital and she was like, yo, I think you would like this. And I said, oh, tried it. It was good. The problem was it was far away from my house. It was over an hour commute to get there. And then the hospital politics thing was a little bit overburdensome for me. I still am very sensitive to that aspect of any type of leadership thing. And so I ended up leaving there and just kind of pitter pattering around for a little bit before I ended up in corporate.
And then you started your own business.
Hmm.
Where did you learn how to do that?
So working in performance improvement for a large healthcare system taught me a lot about like cost savings, like revenue generation, a little bit less about like marketing and things like that. I had to learn that on like in real time growing up. But I just took what I did know and I just worked with it. Like I knew how to organize documents, and I knew how to, create processes, and I just knew those things just from that time that I spent there. So I just applied some of that, and I had mentors and coaches along the way, um, and just trial and error.
Okay, 2 last questions about your journey. How did you find a
Yeah.
mentor?
Um, remember I said I always attract the right people? They just come. And to
Okay.
this day, that's the way that I find my people. They just come out, they just come. And I just know that they're my people, and they're supposed to be teaching me. Every person, I've had a book coach before, I've had a business coach before, I've had spiritual coaches before. Like, these all have contributed to everything that I've done. And I guess just a little perspective about even how I approach the work that I do. It's my I feel like my forever journey is, how can I integrate all aspects of myself into myself so they all become one. So my personal and my professional journey are one and the same, in my opinion.
And if someone's watching this, they're at the very beginning of their nursing journey. Maybe they just applied to school, maybe they just start their first semester. What advice
Mhm.
do you have for them?
Um, Nursing journey, right?
Hmm?
I feel like I feel like everything that we believe to be true when we first start out in nursing may be true, but there's so much more.
Mm.
You know what I mean? Like, we get into it and we have this idea about why. Like, there's it's always this big why we became nurses to begin with, and we think that we're gonna do it, and we may actually do it, right? But that's not usually what we do forever, and it's usually not the only option out there. And sometimes we find ourselves stuck doing the things that feel comfortable and not
Yes.
really exploring the possibilities.
All right. Well, thank you.
Yeah.
So, how do you describe medical marijuana?
So I call it cannabis. There's a little bit of a derogatory historical context to marijuana. So around the Mexican Revolution, and we have a sordid history with racism in our country, in America. And so around that time frame, we saw influx of Mexicans coming over the border into America, and they were bringing what they called marijuana, and they demonized it through their propaganda in targeting our Mexican immigrants. And so, generally speaking, from a medical standpoint, we don't, sorry, we don't tend to use the term marijuana. So I do stick with cannabis. How do I describe it? It's a plant. You grow it. The female plants are the plants that grow buds. The male plants we destroy. Very, very iconic representation of the male and female dynamic. And and you can the flower itself, the buds itself, have cannabinoids in it. It has an example of a cannabinoid is THC and CBD. There are over 100 cannabinoids in the plant, all contributing to the overall influence that it has in our bodies. It also has other components to it, like terpenes, and those are also chemical components that support how it, affects your body. And everybody responds to cannabis differently.
And how do you differentiate medical cannabis to what people find in the street or what they have grown up knowing?
So cannabis is just cannabis. It's just flower. How it's been grown plays a part in it. How what it's been mixed with, like, people are putting different chemicals into the flower that make it a little bit more unnatural. I believe in organic cannabis, organic weed. I don't know what you want to call it. That, it's equivalent to being vegan versus pescatarian or something. I don't know. Because you have your plant and it can grow with different nutrients, and some of those nutrients can include like pesticide or like other chemicals that now you're ingesting. And so the issue with whether or not you get cannabis from a local person, a local black market person, whatever you want to call it, that person has a lessened likelihood of having gone through the vetting process of making sure you know what cannabinoids are in the plant, what terpenes are in the plant, whether or not there are any chemicals, pesticides, lead, any of those kind of things. And so, generally speaking, again, this is a generalization. Our local weed man, our local producer, we tend not to want to advertise that. But I think there are caveats when it comes to dealing with people who aren't from the dispensary, because if you grow it and you do it naturally and you take all the care and there's no mold and all those things in it, you could get a good product from your person. Not to say that I'm advocating for it. I'm just saying there's no need to demonize that and differentiate whether it's medical or recreational in that regard. The recreational aspect of it tends to lean more towards, or that differentiation tends to lean more towards a political thing, like how are we using it kind of thing. But at the end of the day, um, every consumer that I've spoken with uses it for a reason, and usually it is for some sort of medical purpose, whether they know it or they don't.
And so, like I said, we're a health literacy platform, so we like to just explain things that people might not understand. So you
Mhm.
mentioned THC and CBD. Can you just
Mhm.
explain those two?
Yeah, THC is delta 9 is a cannabinoid. It is uh like just what everybody's scared of. It has effects on the mind. Um they call it psychoactive, but really it stimulates the mind in ways that may or may not be what you're actually wanting to do, right? Like, so if you take it and it makes you paranoid, that's actually like a side effect. But if you take it and it makes you sleepy, is sleepiness considered a side effect or not? Because you might be actually trying to sleep, right?
Mhm.
So anyway, THC, that's what that is. CBD is cannabidiol. That's the one that, according to the Farm Bill, is federally legal. So can be shipped, can be found online, can be found at the gas station, could be found at wherever you want to find it. And nobody does any real actual monitoring of the plant. So, or that particular substance. And so being mindful about COAs and things like that. But to go a little bit further, there are way more cannabinoids, derivatives of other cannabinoids. So even THC is a derivative of THCA, which is the acidic form of THC. CBDA is the same circumstance, but then there's like CBN, which is so good for like inflammation and nausea. CBG, also good for stomach health. CBC, THCV, like the list goes on. And those cannabinoids, we talk a lot about THC and CBD as if they are their own entity, but again, they work best if they work together.
Oh, okay. And yeah, that CBD, we see it everywhere in everything these days. So people
Yes.
are probably a little bit more familiar with that one. So let's talk about some common misconceptions that you have to address.
Um, oh boy, there's so many. Give me somewhere to start. I can't even think of one.
Oh, okay. So let's say say you have a patient, they've been taking Percocet, right, for the last 5 years. And they complain about the side effects and they can't really function throughout their day and they have constipation, they're nauseous all the time, and it really isn't working. They just
Yeah.
keep taking it because they keep getting prescription and Tylenol doesn't do anything. And you're telling them about the benefits of cannabis. And they're like,
Mhm.
oh, I don't want to take drugs.
Oh yes, that is actually a very common one. Yeah, at the end of the day, we in Western medicine, we use medicine to alleviate symptoms. We're managing symptoms. So if you come and you see a doctor, they're going to write a prescription for you to take something in most circumstances, depending on what's going on. And that medicine is used to suppress whatever is happening. So if you have a cough, you want the cough to go away, that's what it's going to do. A Tessalon Pearl is going to make that happen very quickly. The difference between a Tessalon Pearl or a Percocet or whatever, these are all man-made substances. And these substances have been created in labs for a specific purpose. And sometimes those substances work in our favor when we need it to. And then if you take too much of it, it doesn't work. The same thing is actually true with cannabis, except it's not man-made. It's natural substance. It comes from the earth. It grows in a plant. Unless we tamper with it, it's literally a flower. And upon consumption of this flower is a very similar circumstance, except a little bit less predictable in that everybody responds to it naturally in an individualized way. And that's only because our endocannabinoid systems are different, and the plant genetic composition is different based on, like, how they cloned it and whatever else goes into the growing process. And so if we're going to call it a drug, we might as well call everything a drug, and then let's choose which drugs are best for us in this moment. And I know this, when it comes to our narcotics, too much use of narcotics, the narcotics just stop working, period. And then you find yourself severely physically addicted. When it comes to cannabis, there is a very low threshold of addiction. And generally, the addiction is more psychological than it is physical. Another example of a psychological addiction that people deal with on a day-to-day basis, I'll name two: sugar and social media. So that's what I would say.
Okay. And then what are the latest trends or in research?
So top 3 reasons why people consume: pain, anxiety, and insomnia. Pain being the number 1 reason why people seek it out, and that's usually because people are at their last leg. Like, they had enough. They've been through the ringer. They've gone through everything they can think of to alleviate whatever this pain is, and they said, okay, well, this is the last option. I'm going to try this. And that's usually where people are when they're seeking it out. I forgot the question. What was the last question?
Well, you answered it. You
Okay,
gave
cool.
top 3 reasons, and that's been my experience too, that people look for pain, sleep, and anxiety. There's another
Yes.
whole long list, and we can get into that shortly.
Mhm.
But yeah, they've tried everything that's kind of commercial and societally we've accepted as acceptable, right? We accept that getting a prescription and taking that for decades is acceptable. And so the misconception of, well, I'll take that, but I'm not going to take that drug, that street drug that the
Yeah.
kids take, that those people over there take.
Yeah.
The language and how we normalize some things and not for others, and how, it's okay for certain communities, but it's not for others. And, there's a whole another episode that can be dedicated to the legal aspect of this and how it's been criminalized and those sorts of things. So yeah, you did answer the question.
Okay, perfect.
And so I already know that. Who's a good candidate?
Okay, so there are a lot of good candidates for cannabis in their medical regimen. So the biggest one is if you are suffering with any amount of pain. A common like type of patient is somebody who deals with like severe neurological pains. People with MS, lupus, Guillain-Barré, anything with reduced circulation where it's just painful to walk, it's just painful to stand, it's just painful to be. Those almost ambiguous pain symptoms where, like, maybe you don't know exactly where the pain is, or you're having a hard time describing it and your doctor really can't say to you, like, this is exactly what it is, and we have a differential diagnosis for it, right? Those people will probably be a really good candidate. And I'll tell you why. Because not only will it help relieve the pain, but because of, like, sometimes the you become more hypersensitive in your body. You start to be able to identify your own pains. Like you get so hyper focused on where it is, what you're feeling, how you're feeling it, that now you're able to say, okay, well, I got this pain right here in my knee to the right under the bone. If I push this, I do, like all of a sudden you become a little bit more aware just because of some of the influence that cannabis has on your system. And now you're able to do something about it. Another candidate for this is people who aren't necessarily quote unquote sick. So if the circumstance that I described in myself, I'm not necessarily sick. I don't necessarily need a doctor. I'm not in a place where disease is manifesting, but something's just not okay. And we all know that stress and anxiety are the leading cause for death in most disease processes that are chronic. And so it's easy to assume that if we start here and have a ton of stress, feel overburdened, burnt out, etc., that eventually it'll lead to the manifestation of disease in the body. And so consumption of cannabis helps support the reduction of anxiety and stress, therefore negating the occurrence of that manifestation, the disease manifestation. Those are just two examples.
Yeah, I think those are great. And yeah, so I think what we find is we see our patients dealing with the side effects of the medication, right? And
Mhm.
they're complaining about it. Like I mentioned, the constipation, we're concerned about respiratory depression.
Mhm.
Um, and yeah, then the fact that it just doesn't always work all the time,
Yeah.
right? And then they're back at the doctor or shopping doctors, right? Which is
Mhm.
why we have
Mhm.
systems in place to now monitor when you're going to multiple providers to get a prescription for a medication that was supposed to last 30 days and you ran out in 15 days,
Mhm.
right?
Mhm.
And why, when you come to the hospital, you feel like we're not giving it to you on time because at home you take it every time the pain hits, right?
Yeah.
And because there's a lack of understanding and education on the frequency and how those medications work and all the different types of pain, like you mentioned, nerve pain, right? And I spend a lot of time talking to patients to try to educate them on the difference in types of pain and
Mhm.
how there are certain diseases. You named a few. I think those inflammatory diseases, right? Some of your arthritis, even some of our
Yeah.
vascular diseases. I was like, we can do all these medications, we can do a lot of interventions, but unfortunately, it's not always going to get your pain to a zero, you
Yeah.
know, and that's their goal. And so that's why they're always calling. That's why they're always complaining, scheduling an appointment because they're trying to get to that zero. And I
Yeah.
have to tell them that's not always actually a realistic goal. Let's
Mhm.
find another one because sometimes the disease or the damage that's been done through our lifestyle
Mhm.
it's a little bit too late to go backwards.
Mhm.
So those medications are not necessarily going to be effective. And so what we've loved about cannabis in the medical setting is we don't have those same concerns, and we're seeing that patients are so much more happy and satisfied
Mhm.
because you have pain, you have anxiety, you have lack of sleep, and sometimes people have issues with nausea. This is Breast Cancer Awareness Month, so we know
Mhm.
nausea is a problem. It helps with
Yeah.
appetite, right?
Yeah.
If you're going through chemo or you're, one of our retired adults who maybe their appetite has gone down and we're trying to increase your weight. And so
Yeah.
we're eating so many check boxes,
Yeah.
not worried about the other problems, which we start to be more resistant and hesitant, and then the patient doesn't feel like their needs are being met because we're so concerned about the safety profile of that medication. Um,
Mhm.
and so,
Yeah.
yeah, in my experience, we've all been a really big proponent of it. And I think the thing that's missing is just the education to the public that everyone's a good candidate.
Yeah. And, I think what you spoke on is like quality of life. Like, sometimes when we start getting mixed up in our healthcare system, the quality of life decreases significantly. I mean, if you're going from doctor to doctor, you're just waiting in offices all day, not being satisfied with the experience because you're expecting a 0 and you're walking away in a 5, like all these things. And now you're fresh, like it's stacking on more and more frustrations, and just the quality of life just tends to plummet. And just from a holistic standpoint, what's the point in living in this world if we're miserable the entire time?
Yeah, and then, that cancer patient, they're being cared by their
Mhm.
loved ones, who's
Mhm.
up all hours of the day.
Yeah.
They're doing a million things to keep you alive. Their health is deteriorating. They're dealing with their own
Yeah.
anxiety, their own lack of sleep, and
Mhm.
so both people can now be a great candidate for
Yeah.
better quality of life, better anxiety management. And what we're trying to make people realize is some of these things, they're not going away. We're here
Yeah.
to help manage it. You started the show by talking about symptom management.
Mhm.
We're realistic to the fact that not everything is curable, treatable, resolvable, fixable. And I
Mhm.
think sometimes we don't sell that enough to the public, and they
Yeah.
get super disappointed. They lose so much trust in us because we're not reaching the same goals because we don't have the same goals in mind,
Yes.
you know?
Yeah.
And while not everything is fixable, we do have the same goal in that quality of life aspect in helping you be independent, on helping you function day to day, spending time with your loved ones, doing all the things without having to be in these doctor's appointments, these hospital settings, especially if it's as easy as providing this knowledge, letting
Yeah.
you know what to expect, and to let you know that so many people just like you have uh, been able to get the outcome that they want.
Yeah, for sure. For sure.
And so what have you I mean, besides the lack of knowledge, what other barriers to care have you noticed?
The biggest thing is access. So not every state has all products. Um, Generally, there's a focus on flower, which is fine, but not everybody wants to smoke it. Not in the position to smoke it. Just it just isn't a good option for them. So having different methods of consumption or accessible is important. That can show up in the form of transdermals. It can show up in the form of edibles, suppositories, inhalers, dry herb vape, that kind of thing. Um, I think that's a huge one. I think another area is just around the fact that there's just stigma in general, right? Like, so if you are a person who is interested in exploring it, who do you go and talk to? Right? Do you even feel comfortable talking to your healthcare provider or even your cousin, your sister, whoever, about it and your interests? Because if we're not having conversation about it makes it kind of difficult to even get to it regularly and consistently and mindfully, like you're always trying to be under the radar about it. And then the other issue that comes up is overconsumption. um because a lot of people feel like there's this mainstream idea that like we're supposed to smoke joints and things like that. Like, no, actually your joint should last you quite a while. Especially if we're using it mindfully and medically. Inhale counts matter. How much you take, because it doesn't work the same way as other medications in our system. It's there's a threshold, a window of dosage that we want to stay within. It's the therapeutic range, and you it really is a trial and error kind of situation when you're working with patients and trying to figure out where that therapeutic window is. And so a lot of times people will take in too much, consume too much, and then now like you're not getting the most out of the plant. There's a mantra in the cannabis industry: start low and stay slow. I mean, start low, go slow. And so you just go from there. But this need to want to like do it the best, or and if the best means how much I can take, that kind of takes away from the therapeutic benefits of it.
So you mentioned products. Can you go down that list again on the different
Mhm.
ways people can
Yes.
consume it?
So there's transdermals. Those are patches, and that goes into your bloodstream. There are different types. Um, there are topicals. Those usually don't go into the bloodstream, depending on how they are formulated, and they're good for like eczema and things like that. Edibles, people are familiar with, but generally everybody I talk to is scared of them because they took too much of them and they ended up under the table one fateful night, which is funny to me. And then, but they can be used therapeutically as well. And generally with a 10 milligram gummy, because I usually sell them that way, I would tell somebody who's just getting started to cut it up into 6 pieces.
Mm.
Yeah, that's small. And then there are suppositories. They can use them rectally or vaginally. Very good for womb issues, general pelvic pain, things like that. There are inhalers is another vapor form of consumption. That's all I can think of right now.
Okay, so you mentioned pregnancy. Can we talk about the safety profile when it comes to age and pregnancy?
Yeah. So in the pregnant area, I don't work with pregnant women personally. So I will put that out there. But generally, and mostly is because the written evidence is limited. But the conversation, in my opinion, is around risk and benefit in regard to mom and fetus. And so there are a lot of women that I know that chose to consume during pregnancy for various reasons, like severe nausea, different types of pain, different anxiety, where they felt they would not be functional without it. And so that's where, the conversation is, okay, how does this affect baby? How does this affect mom? Ideally, in any pregnancy, you want to be as clean as possible. And when we're talking about consumption, we're talking about food, we're talking about what we put on our skin, we're talking about, all the things around consumption. We want to be as clean as possible. And so those same considerations can be applied to cannabis when we're talking about how and when we consume. And so if we can not smoke it versus eat it versus transfer, like all of those things play a part in how mom chooses to consume it. But generally, it's just a conversation of risk and benefit.
And so you talked about one of the barriers to care is access. So how does someone get started?
Using cannabis, you mean?
Like from scratch, do they make an appointment with their doctor? Do they schedule to go to the dispensary? Do they have to get like a card or something?
Oh, okay. So every state is different. I live in Maryland right now. We're a recreational state. We were a medical state. We just went rec, I think, in 23. And we just went medical in 2018. So I was able to watch the progression of how that works. So in a state that is neither medical or recreational, you should not have anything but CBD available to you. You might see smoke shops that sell CBD and things like that. But generally speaking, it's very difficult to find whole flower, full spectrum flower. When we're talking about our medical states, they will have medical grade programs theoretically available. You usually have to go to a doctor or a nurse practitioner of some sort in order to get certified. And then the certification allows you access to get a medical cannabis card of some sort or some sort of like documentation that you got certified. And then you can take that and take it into the dispensary and you can shop for your products there. If you are in a recreational state, generally the rules are around being over 21 in order to access the dispensaries. And some of the caveats and differences about what you have access to change based on medical and recreational, policies and legislation. So, but in Maryland, for example, our recreational model allows us access to a certain amount. And I can't remember the exact numbers, but a certain amount of edible products. Like we can't have those high, big dose edible products unless you're a medical patient. You can't get your allotment is a lot less if you're not a medical patient, things like that. And so, yeah, so that's the process.
So is someone keeping track of that allotment, like at the
Mhm.
dispensary? Or oh, okay, kind of like, I guess, a dose for like a narcotic.
Yeah. Yeah, so they track, so it doesn't go into, I can't, what's the system you all use to track the narcotics? You know, do you know?
Oh, mm.
But it doesn't go in there.
No way. Okay.
Yeah, it doesn't go in there where you could be like, "Oh, okay, this person taking this amount."
Prescription drug monitoring
Yeah,
program.
yeah, yeah. It doesn't go in there, right? But they have our state specifically. I don't know all the nuances of every state, but basically every time you purchase it, it goes into this like this bank that lets you know that you bought you bought a gram today, and then they'll keep track of it over a 30-day rolling cycle.
Oh.
And if you're a medical patient, they can choose your allotment, so they can actually increase how much you have access to in that allotment. And basically, when you go in there, they can say, oh, okay, you have this amount left in your allotment. You can put that, the whole thing. And so that helps with people like if I wanted to go in and buy a pound of something and then go sell it on the street, you know what I mean? Like I can't do that now because it really is just enough for personal use.
Okay. That makes sense. And then, so you did talk a little bit about dosage. So if I'm starting off and do you have a favorite form?
No, it's a lot of fun. You can try all the different ones.
And so when you get that appointment, will someone give you instructions on like how to use it and how to divide it up?
That's where I come in a lot of cases. So a lot of medical providers, so I can't certify. I am not a nurse practitioner. I'm not a physician. So I can't certify, but a lot of times our providers don't have enough information to help guide the patients to find the products that will work for them and make informed decisions about that. So a lot of times the patients will, so I work for dispensaries too. I'm partnered up with dispensaries. So they'll go into the dispensary, and then if they have questions of the bud tender that the bud tender can't answer, then they come to me as a medical professional to help them say, okay, like consider these drugs, take, these medications, probably not a good fit. Talk to your doctor about this, this method of consumption because it's long acting or short, like all of those kind of things are things that I would talk to them about. But generally speaking, there is not a ton of consistency in regard to how we get informed about our cannabis when we're using it for medicinal purposes.
The person at the dispensary, you call them a bud
tender.
Bud tender. Okay.
Mm-hmm.
And are there licenses for those people? How do you find how do you know that you're going to a credible license place?
So our dispensaries are, in order to operate legally, they have to have a license, but that doesn't speak to the quality of the products that they have in their dispensary. Further, our growers also have to be licensed, right? But again, it doesn't really speak to the quality of the products that are being produced. But what does is the COA, is a certificate of analysis. Every dispensary that you go to should be able to furnish a certificate of analysis or a COA. On that COA, it'll let you know if there are any chemicals or anything in your bud. It also lets you know the cannabinoid profile. It'll let you know the terpene profile and anything else you need to know about that product. And so when we're talking to our bud tenders, there are no true, not that I'm aware of, I've never been a bud tender, but because I don't want them to come get me or nothing, but but I don't believe they have a ton of qualifications as far as becoming a bud tender. Generally speaking, they are they're enthusiasts. They love the plant. And they generally like to consume the plant, and their experiences are what guide how they interact with the patient compared to a medical professional who is aware of anatomy and physiology, pathophysiology, that kind of thing. So that's the difference.
Yeah, like me, like these
Right.
questions I'm asking. And then so you said so we refer them to you, right?
Mm-hmm.
Have you had any, because I'm trying to think, are there any contraindicated diagnoses for people who wouldn't be a good candidate?
Schizophrenia is one that is an area where in bipolar, like those severe, psychotic mental diseases, mental health diseases, definitely be very weary and cautious of because it can inflame. Um, Depression, if they're taking SSRIs, probably not a good idea. Not to say that they can't depression, because it can help with depression, but it can also inflame depression depending on how it's used. But the SSRIs specifically, they I forget the receptor that CBD and the SSRI bind to, and so generally, the SSRI ends up free floating in the bloodstream and not being used properly. The other thing to consider is that cannabis is also processed by the liver. So if you are, you know, if your liver is not fully functional, I'll say it that way, then it could cause some issues with how how well you process other medications, other foods, other herbs, other whatever else you put in your system. So making sure that we're mindful of that when we're using it is important.
So when you get a referral, do you ever have to call that provider and say this person's not a good candidate, or we?
Um, it's a patient driven. So unless it's a situation where the patient actually connected me with the provider and like we were like, deliberating on what works best, the doctor ultimately drives the care of the patient. So I'm just here as a supportive reference, so that way we can make sure that we're bringing in your whole team to help support your healthcare. And that's generally what that looks like. But it's a patient driven medication, so they can go to the dispensary themselves, go pick it up themselves, go buy it, smoke it, eat it, chew it, whatever, all on their own. There's nobody monitoring what they choose to do with this plant, which is why education is super important when it comes to this, because again, we're mixing pharmaceuticals, we're mixing herbs, and it can create a worse situation than a better one in certain situations.
Exactly. And so if someone's interested in seeking your services, do they go to your website?
Yeah, they can find me on Instagram, your cannabis nurse, or they can go to letsreignite.com and they can find me there. I am happy to receive an email if you just have questions, cannabisnursingsolutions@gmail.com.
And so they go there, they can schedule an appointment with you directly on the website.
Yes.
And who's on your team?
We a solopreneur right now. We a solopreneur. I got some admin help in the background, but yeah, it's just me.
And so that appointment is in person or virtual?
It's virtual.
And what does that look like?
So right now, the way that I have it set up is set up more like holistic life coaching. So we're looking at the whole person. So if you're interested in consuming, if you do consume, that's great. We'll talk about those things, but we're also going to talk about your regimen, what you do on a day-to-day basis, how you support your wellness in other ways, how you're eating, spirituality. We talk about emotional intelligence. We talk about human design. All of those things. Are you moving and optimizing your experience here while you're just living life? And so that's really how I support people in their journey, and we include cannabis in that. But it could include lavender, and it could include mugwort, and it could include crystals, and different types of things. It just depends on where you are in your journey.
And what determines how many sessions they have with you?
What they choose.
Oh, okay.
Yep.
And after, do you offer free consultations or how does that
Mhm.
work?
I
Okay.
do. I offer a free discovery call,
Okay.
and we'll go through and just figure out where the where the need is, because sometimes people come and they really don't need nothing. They just need somebody to talk to for a little bit. Yeah, and then sometimes there is a real need that needs to be addressed, and we need to reset some ideas, expand ideas, create ways and plans and put things in place to help people facilitate what they're trying to achieve. So yeah.
And you're in Maryland. Can you help anybody anywhere or just people in Maryland?
I can help anybody anywhere.
Oh, wonderful. And what forms of pay do you accept?
Um I like PayPal, credit cards. You could do a Cash App if you want to. If you want to Zelle me, I'll be happy with that too. Yeah, we're flexible.
Insurance?
No insurance, no.
Mm. Payment plans?
Yes, I'm very flexible in that way. Yes.
Age requirement?
Over 21. I don't work with children, and I don't work with pregnant people.
Okay. And the long-term relationship, can people, how do they have a follow-up question? They send you an email, a text, or have patient portal?
So yeah, I work in Telegram. So we'll be always be in contact. I don't work with people that can't contact me when they need to.
And so before we close out,
Mm.
me, Geraldine, and Alicia were all straight Black females. And so we always want to be mindful of the people who aren't sitting at our table. So we have a list of people we consider to be vulnerable, part of the vulnerable population. So I'll just go down that list and see if there's any sort of special considerations that you think are appropriate. I think let's start with children. Anything that comes to mind when you think about children and cannabis?
Yeah, for sure. So it is an option for children. Um, and there are a lot of variables in place when it comes to children. Age is definitely one of them. So the difference between an adolescent and a toddler is huge. Again, we're talking about risk and benefit. Then we also need to talk about what their choices are and what their belief systems are around cannabis as medicine, because again, there is room for abuse when it comes to it. So let's start young age, toddlerhood. Like the most common reason why younger children would benefit from cannabis is usually severe seizure disorder or something that disrupts their just general quality of life. They're also in the hospitals. A lot of autoimmune disorders are another area where we might see children using cannabis. Um, but then it poses another like conundrum with adolescent children, because now here we're experimenting with cannabis, right? And so now we're talking about peer pressure and things like that. Sometimes our adolescent children are consuming it and finding it to be beneficial, supporting them with their ADD or ADHD. They find it supportive in their depression, just their experience going to school. Maybe they're feeling, like not good enough. We're talking about insecurities and things like that. And so sometimes cannabis will show up and be a support in that way. And so this is where it's very easy to take something that helps and then kind of get lost in this dark place, behind it. So being very aware and informing our our adolescents, how to mindfully use it if that's the choice that they're going to make, and how to be safe about it. Because again, you could have fentanyl, rat poisoning, embalming fluid, all these different things in your medicine. So we don't want young people going out and just getting it from anywhere. So yeah, those are the biggest things.
And what about our retired adults?
You know what? They can do what they want. Our retired adults have lived their productive years, right? Like, and most of them have been stressed out their entire life, and they're at the place in their life where they're reflecting and recognizing the good and the bad that they contributed to society. And while they're going through that process, it's almost like a grieving process where they settle into where they are, and to have cannabis support them in that journey, I think is beautiful. And not to mention, if it can relieve some pain, it can help them relax, it can help them just have a good time. I like to see our older adults having fun and communing and going to play games and all those kind of things. And so if it gives them the opportunity to do it, go ahead and do it.
I agree, and especially with that depression, that's really
Mhm,
common, especially as our family and our friend, we outlive our family and our friends.
mhm,
Very common, and we get
mhm,
isolated when it comes to sensory deficits. When we start losing our vision and our hearing, we get isolated. So it's a
mhm.
very common thing. Older adults are my favorite population, so I can go
Yeah.
on another hour about that. But also with sleep, because we just know the aging process interrupts our sleep big time.
Yes.
So they tend to take these other medications like Tylenol, ibuprofen, to put them to sleep, and they end
Mhm.
up in the hospital for bleeding.
Yeah.
You know,
Yeah,
that's a real thing,
it
and
is.
sometimes it's associated with falling, and then it robs them of their independence, of their ability to stay in the home that they built with their family. So those are real conversations, right?
Yeah,
And
yeah,
sometimes it's just about addressing a very common symptom that they're having, right? We're talking
yeah.
about symptom management.
Mhm.
Do you have any programs or anything you wanna say when it comes to veterans?
I don't have any programs in regard to veterans, but definitely a group of people that are near and dear to my heart, especially because they deal with so much from a mental health perspective, and so definitely being able to take advantage of some of those cannabis is very, very helpful. I've seen some heart wrenching people share their experiences. They were so heart wrenching around like being prescribed opioids and things like that. And suicide is so prevalent in that population. So again, if we can just make it worth living in this lifetime, using this medicine, I think it's worth it.
Another population high suicide rates is the LGBTQIA plus population. Anything there?
Nothing specific to the medical use of cannabis, but they, obviously they can benefit from it just like anybody else could. And I think a big thing with our LGBTQ community is I think as a collective have been, ostracized, and there's a little bit of PTSD even with how they engage with society. And so if we can kind of bring down some of those defense mechanisms so we can relax into our body and feel good about where we are and who we are and what we do and why we do it. I think that's a beautiful conversation to have.
And the last one would be anyone on the autism spectrum.
Oh yeah, that's where the kids. That's another area for the kids too. Depending on where they are on the spectrum and how much it affects their day to day functioning. But many of them they get so overstimulated, and and now you see these behavior crises occur, and so for so many people, our children, young people, anybody on the autism spectrum, anybody on autism can benefit from it just out of that ability to just relax in your skin. I just can't imagine what it would feel like to hear something simple as like maybe a bell and be petrified of it because now I'm overstimulated. And it's hard to get that cascade effect to go away once it's already been activated.
Thank you so much. You did a beautiful job giving time to that. It's a new thing we kind of added on this year. And I love how you spent time with each one and really gave them their attention. And you brought up things I wasn't even thinking or expecting.
Cool.
Anything you want to leave the audience with before I close this out?
You know what? Just have a great day. Have a day of your choice. How about that?
We can't thank you enough for sharing your nursing journey. It's not why you came on, but because I hear from so many people who want to enter the industry, both young and seasoned, I think it's really important. And you shared a lot of information that's going to help people who are just looking for a starting point and an example. You did a great job giving us some history. I love history. You talked about common misconceptions, trends. You did a beautiful job humanizing the community and making it very acceptable. You brought up the big importance of addressing barriers to care and the knowledge gap. And you're an example yourself, and people can see themselves through our stories. And you did a beautiful job with that. We thank you for being part of our Breast Cancer Awareness Month and allowing us to use your expertise and promote your business. That's your baby. You have a lot of pride when it comes to that. And you've allowed us to be a part of that and bring it to the global community. And we'll have all your links and information in the description box. And we really can't thank you enough for doing this, because your knowledge and your experience is valuable in terms of financial compensation, something nurses don't get enough of or hear enough of. And we want to make sure the public is aware that everything you shared here does have a price associated with that. And you've been kind enough to share it for free.
Absolutely. Of course. Thank you.
Yeah. You're always welcome back anytime you want to. If you start a new service in your business or a new book or whatever initiatives, the invitation remains open.
Oh, thank you so much. I really appreciate it.
Remember, everyone, you can email us your questions or show ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel, LinkedIn, and all our social media platforms. Say hello in the comment when you get there. Please share the show with your friends and rate the Apple and Spotify podcast. Leave a comment. Like I said, it really helps support the show and gets the message out there to those who need to hear it. You can find all of our links in the description box, and any resources that we've mentioned will be there as well. At the time of this filming, we release new episodes on Sundays at noon Eastern on LinkedIn, YouTube, Instagram. The audio goes live at 5 a.m. so that our night shift friends can be the first to get something and not the last. And so our day shifters have something to listen to on their way into work. Thank you again for joining us today. And thank you everyone for watching. We'll see you next time.